Amity Overall Labe, and I'm with the National Ombudsman Resource Center. And we'll get started here in a couple minutes. So you're going to be on hold and we'll get started. And just to let you know, your lines are muted. And thank you for joining us. We'll start in just a couple minutes. Hello again, everyone. As I said earlier, my name is Amity Overall Labe. I'm the director of the National Long-Term Care Ombudsman Resource Center. And thanks for joining us this afternoon. We're going to talk about the who, what, where, why, and how of the Ombudsman program. And I'm going to share some resources from both the Resource Center and our host agency, Consumer Voice. So before we get into the presentation, I do want to go through some housekeeping, and then I'll pass it over to Bill for a brief welcome. So just to let you know, there's a control panel. You can see it on the right side of your screen. And we will have time for questions at the end of the presentation, but until then, all the lines are muted. So if you have a question, feel free to enter that into the question box, and we'll get to that after the end of the presentation. You can also raise your hand if you have a question. There's a little raise hand icon, or if you're having issues with your audio or visual, you can let us know as well. It's usually better to use your landline instead of connect by speakers, depending on how strong your internet connection is. And also to let you know, we will be recording this, and so this will be available after today's call as well. So now I'm going to pass it over to Bill for a welcome, and then we'll get into the presentation. Thank you. All right, go ahead, Bill. You may still be on mute. You may have to unmute yourself. Sorry, Bill, I still can't hear you. You're unmuted on our end, so you may have to unmute your landline as well, or your cell phone.
Yeah, nope, I'm unmuted. Sorry, were you?
Oh, there you are.
Can you hear me?
Okay.
Okay. Yep,
yes.
Sorry about that.
No problem. Go ahead. Okay, Bill, did you have a brief welcome that you wanted to share before I go into the presentation, or?
Yeah, sorry, I was cutting out there for a second. Hello, everybody. My name is Bill Cawley with the Parent Family Support Program and the director of the program. And just want to say hello to everybody and welcome you all. I'm glad you could join us. We're really looking forward to hearing more about this program, and Amity has been great about sharing with us some insight about how the program works and what it does, and we think it might be a real benefit to all the peer mentors out there and other people who may be joining as well that advocate or work with folks who are living with paralysis and their family members and caregivers. So we're really looking forward to it and glad you could join, and we'll kick it over to you, Amity, and looking forward to it again, like I said, so thank you.
Excellent. Thank you, Bill. And I'm so glad to meet you and Rebecca through this, and I'm glad that we're doing these webinars for our network. So let's get started. What is the National Ombudsman Resource Center? Just some highlights. We are a federally funded, we're federally funded through a grant, and the grant is from the Administration on Aging, Administration for Community Living, and it's a 3-year grant. and it's operated by the National Consumer Voice for Quality Long-Term Care, also known as Consumer Voice, in cooperation with the National Association of States United for Aging and Disabilities. And later on in the presentation, after we talk about the Ombudsman Program and the Resource Center, I will share some information about Consumer Voice, as well as some resources that are available through Consumer Voice. So the Resource Center, we are responsible for providing support, technical assistance, and training for state long-term care ombudsman programs and their program representatives. So for example, we provide information and consultation to individuals that contact us looking for ombudsman programs throughout the country. And we provide training and we create resources for state ombudsman programs and their representatives. So for example, we've created materials about the ombudsman role in investigating abuse, neglect, and exploitation. We've created materials about supporting resident empowerment, and many, many more. We are also responsible for promoting awareness of the role of the Ombudsman Program, and we work to improve ombudsman skills, knowledge, and effectiveness in both their advocacy and their program management. So first and foremost, the Ombudsman Program advocates for the quality of life and care of residents in nursing homes, board-in care, also known as assisted living facilities, and other similar adult homes. And most importantly, the Ombudsman programs are resident-directed advocates, meaning that residents direct all steps of ombudsman advocacy, which we'll get into in just a few minutes. The Ombudsman Program was created by the Older Americans Act and tasked with investigating and resolving complaints, providing information to residents, families, and facility staff, for example, about resident rights and other issues, and to advocate for systemic changes to improve residents' care and quality of life. To give you a little background about the Ombudsman Program, because it's been around for quite a while, in 1972, there were 5 nursing home ombudsman demonstration programs established to focus primarily on nursing home resident complaints. And then in 1978, in the Older Americans Act amendments, it required all states to establish a nursing home ombudsman program. The program, and it's important for a lot of reasons, it was originally designed to be a local community program that really utilizes volunteers. That was important because the original intent of the program was to have volunteers visiting communities in their own nursing homes in their own communities. So therefore, there's neighbors supporting neighbors and neighbors advocating for people that they know. In 1981, duties were expanded to board and care homes, otherwise known as assisted living facilities. And so the name of the program was changed from Nursing Home Ombudsman to Long-Term Care Ombudsman. In 1987, the Ombudsman Program gained access to resident records, but they have to have resident consent first. And it needs to be related to some type of complaint investigation and resolution process. States were also required to prohibit willful interference of official Ombudsman Program duties and/or retaliation against an Ombudsman Program representative or a resident or another individual that was using Ombudsman Program services. In 2015, final federal regulations were created and published for the Ombudsman Program in the Federal Register. So that meant that for several decades, the only guidance for the program was the original framework in the Older Americans Act. So states created and operated their ombudsman programs somewhat differently. And so states for the last, since February 2015, for the last few months and years, have been working on implementing the rule and making sure that their state program is in compliance with everything in the federal regulations. So according to the Older Americans Act and the Ombudsman Program regulations, responsibilities of the program include identifying, investigating, and resolving complaints made by or on behalf of residents, educating consumers about resident rights, good care practices, and other related topics, providing information to the public regarding long-term care facilities and services, resident rights, and legislative and policy issues, educating providers about resident rights, good care practices, how to prevent and investigate abuse and neglect, and other issues regarding quality of life and care. Ombudsman programs are also responsible for helping to support resident and family councils by providing information and assistance and getting them started or strengthening the council. They're also responsible for advocating for improvements in the long-term care system. So not only do Ombudsman program representatives investigate individual complaints on behalf of individual residents, they also look at the system, whether it's that particular nursing home and how that's operating as a system, or perhaps a chain of nursing homes or assisted living facilities that are owned and operated by the same company, and what's going on within that system, or the system more globally, maybe from the state perspective or the federal perspective. So the Ombudsman program is really unique in the fact that it's an Older Americans Act program that is tasked with that level of advocacy. It's very, very unique and very important. And they're also responsible for ensuring that residents have regular and timely access to Ombudsman program services. Per the federal requirements, as I mentioned earlier, the program identifies, investigates, and resolves complaints regarding action, inaction, or decisions that may adversely affect the health, safety, welfare, or rights of residents, made by or on behalf of residents. And those complaints can also include allegations of abuse, neglect, and exploitation. But it's really important to mention that because the Ombudsman program was created to be a resident-directed program and resident-centered advocates, they are directed by resident goals for complaint resolution. So therefore, the Ombudsman role in investigating allegations of abuse is really unique, and it differs significantly from other entities such as Adult Protective Services or state licensing and certification agencies. So more specifically, Ombudsman programs do not conduct licensing and regulatory inspections or investigations of long-term care facilities. However, Ombudsmen are very knowledgeable of both federal and state regulations, and they will draw from those regulations as they advocate for the highest quality of life and care of residents. And if necessary, with resident consent, the Ombudsman program will file a complaint with licensing and regulatory. Also, the Ombudsman program, they are not Adult Protective Services investigators. So Ombudsman programs provide information regarding preventing and reporting abuse, but they do not have the same standard of evidence required as an APS worker does. So they're not an official finder of fact. So they investigate to resolve complaints to the satisfaction of the resident. They're not investigating an abuse allegation to gather evidence to substantiate that it occurred. If necessary, with resident consent, or perhaps the permission of the state ombudsman, if the resident can't consent and does not have a legal representative, the ombudsman will file a complaint about the alleged abuse. And last but not least, Ombudsman program representatives do not provide direct care for residents. They share information about quality care practices and resources and ways to enhance the quality of life for residents, and they act as a resource, not just for staff training and residents, but also for family members when they're looking for quality care practices, but they do not provide direct care for residents. So who does the Ombudsman program serve? They serve anyone, regardless of age, living in a long-term care facility in their state or whatever region that they're in. So the long-term care facilities are defined as nursing homes, assisted living or board-in care, or similar adult care facilities as designated by their state. In accordance with federal law, these facilities must provide the Ombudsman program with access to residents. And in a small number of states, Ombudsman programs actually also visit individuals that receive long-term care services and supports in their own home. But that's only about 10 to 13 states that do that right now. And as I mentioned briefly earlier, as resident advocates, the resident guides Ombudsman action if they're able to consent. The Ombudsman program needs resident consent prior to taking any action on a complaint. So for example, if a family member or a friend contacts the Ombudsman program with concerns about their loved one's care, the first step the Ombudsman would take is going out and visiting that resident and seeing if the resident has the capacity to consent, and if they want and feel that if they share that concern or complaint in order for the Ombudsman program to take action. Because sometimes the family member or friend has different interests and concerns than the actual resident, and the Ombudsman program is guided by the resident. The Ombudsman program seeks to resolve complaints to the resident's satisfaction. So again, kind of goes back to that last point. It's not the family member's satisfaction or the visitor, the resident's friend. It's the resident's satisfaction if they're able to provide consent and participate in that process to the best of their ability. The Ombudsman program represents residents' interests both individually and systemically, and they empower residents, and they really, really want to promote self-advocacy. So there are times where maybe the resident didn't even know that they had both federally protected and state protected resident rights. And so they didn't know they had the right to complain about their care, or they didn't know that they had a right to ask about their care and be involved in the care planning process. Then the Ombudsman program a lot of times are simply providing information about their rights and tips on how to use their rights whenever they're working with facility staff or anyone else concerned about their care, and to get involved and start making those decisions again and being involved in that process. So they really, really focus on self-advocacy when self-advocacy is possible and when the resident wants to be that involved. So who represents the Ombudsman program? There are 53 state Ombudsman programs, so that's one in each state, and then territories, and then Washington, D.C. And program structure varies. So for example, there are some programs that are what we call centralized, which means that all representatives of the Ombudsman program are actually employees of the state or employees of the one agency that runs the Ombudsman program. And then there's the decentralized model, which is actually more common across the country, and that means that there's a state ombudsman, and there are state office staff if they have any, and then their program representatives are what's often called local ombudsman local ombudsmen, and they're part of local ombudsman entities, which are often housed in host agencies, which are frequently area agencies on aging, if you're familiar with those. So the decentralized model means that there's usually a local or regional program covering every area of the state. So there are 552 local ombudsman entities. So that's what I was talking about with the local ombudsman entity that covers a specific region of the state, whether it's one county or sometimes as many as 26 counties, if that's how they divide the state up, or the regions. There were 1,300 full-time staff part of the Ombudsman program across the country in 2015, and there were over 7,000 certified volunteers that were part of the Ombudsman program. So what that means is that those volunteers, just like any other designee of the office, serving as a representative of the program, they do receive training, and they often go through what's called a certification process in order to be designated as a representative. And they donated over 700,000 hours of service in 2015. However, that said, not all programs utilize volunteers, but most of them, a lot of them do. I wanted to provide you with a snapshot of Ombudsman program activities in 2015, just to give you an idea of what type of work they do out in the field. In 2015, programs visited over 27,000 long-term care facilities at least quarterly. They attended over 22,000 resident council meetings and over 2,000 family council meetings. So what those are, it's exactly what it sounds like. It's a group of residents or a group of family members that are part of a facility, whether it's a nursing home or assisted living community, and they come together to share concerns and to work through those concerns or make suggestions about their care and quality of life to the facility staff, and they work together as a council. So that's an excellent way for residents, especially those that maybe don't feel comfortable addressing concerns individually. It's an excellent vehicle for them to come together with their peers and share their concerns and then address them as a group. So Ombudsman programs often attend those meetings with invitation. They have to be invited in order to attend because it is the residents' meeting or the family's meeting. And they go and provide information to those council members, and sometimes even give presentations about resident rights or some advocacy tips for handling complaints. Ombudsman programs provided over 10,000 community education sessions, and those can be a variety of different things, but it basically means that it's out in the community. So maybe it's they attend and have a booth at a health fair, and they have a brief presentation for people attending the health fair about the Ombudsman program. Or they go out to the local Elks Lodge or some other community group and provide information about the Ombudsman program and how they can support individuals looking for long-term care. They provided over 5,000 trainings for long-term care facility staff, so that's actually going into the facilities and providing in-service training, both in nursing home settings as well as assisted living, to their staff. Frequent topics are resident rights, abuse and neglect, resident-centered care or culture change, and so there's a variety of topics, and Ombudsman programs go and provide that training to facility staff. They provided over 100,000 consultations to facility staff, and what that means is what I mentioned a few slides back about sharing information about good care practices. So it's really just sharing information with facility staff about providing quality care, quality person-centered, resident-focused care. And then Ombudsman programs provided nearly 400,000 pieces or instances of information and consultation to individuals. So whether that's actual facility residents or their family members or other individuals in the community that contacted the Ombudsman program, that just means that they shared information about long-term care services and supports in their community or state, or information about resident rights, or information about how to file a complaint, etc. So lots of contact with residents and the community, lots of outreach and information. So they're not just focused on investigating complaints. They provide a lot of information and support to individuals about long-term care. And about complaint investigations, I wanted to kind of provide a brief overview. We could talk for a very long time about the nuances about Ombudsman complaint investigation and their process. But I do want to provide kind of a high-level overview and some highlights that I'd like you to recall and walk away with from today's presentation. Ombudsman program representatives, as I addressed earlier, they do investigate individual complaints, and they also address concerns that impact several residents within a facility. Ombudsman program representatives can also address concerns that they observe during a visit. So if they observe strong odors or anything in the environment, maybe there's an issue with cleanliness or some materials that spilled or something that's hazardous, then certainly the ombudsman representative can bring that up with the staff to address it. There's also, if they observe staff not respecting resident privacy by not knocking on the resident's door and waiting for a response before entering, that's something else that they would observe and look for during a visit and make sure to discuss with the staff and remind them about residents' rights and privacy and dignity. Ombudsman program representatives cannot share personal resident information without resident consent, and they do investigate to gather facts, but again, the main goal is to resolve the issue to the resident's satisfaction. And they call upon others to fulfill their responsibilities for residents, meaning the Ombudsman program, they advocate for other people to do what they're required to do for the resident. They're not going to take on and provide direct care or provide social work services or provide anything else that some other entity or staff person is supposed to do. The Ombudsman program is just supposed to identify issues and advocate for the resident to make sure that the resident's getting what they need from that staff person or entity or agency. And again, the program representative can represent resident needs by working for legislative and regulatory changes. So what we often call as systems advocacy, looking at the big picture and how it impacts individual residents. Since each state has a state ombudsman program, there is a state ombudsman that is the lead of each statewide program, and they are technically the head of the office of the state ombudsman program. And so ideally, a lot of the systems advocacy, especially if it's legislative or regulatory changes, those are led oftentimes by the state ombudsman, and they work in coordination with their local ombudsman program representatives if they have any, if it's a decentralized program. So the state programs really are working to be consistent and cohesive when it comes to systems advocacy, but it's definitely led by the state ombudsman. So at the federal level, there is a system to collect ombudsman program data. So that's where I was getting those numbers from, and I included the link a few slides up. And it's also available on our website, but that system is called the National Ombudsman Reporting System, otherwise known as NORS. And so this complaint data that I'm about to share is from 2015. Nationwide, the Ombudsman program investigated and worked to resolve nearly 200,000 complaints. And they handle quite a variety of complaints about quality of life and care, and you'll see that in a couple of slides because I'm going to share the top 10. And just so you know, not all complaints are about the care actually provided by the long-term care facilities. Sometimes complaints can involve outside agencies or entities or services. So the complaint may actually be about Medicaid and someone's Medicaid eligibility if the processing is slow, or other benefits, or maybe it's a hospice provider that's coming into the nursing home, and that's where the complaint actually lies with the hospice provider, not the nursing home care. So there's quite a variety on the type of complaints, and then it's not all the actual facility staff that the complaint's about. And ombudsman programs can receive and respond to complaints from individuals other than the resident, but like I mentioned earlier, they will check with the resident to get resident permission before proceeding with that complaint and make sure what the outcome of that complaint the resident actually wants. So I wanted to share with you an idea of the complaints that Ombudsman programs see. Right now, there are over 100 different complaint codes that Ombudsman programs can use when they're collecting their data and logging their complaints. And these are the top 10 complaints across the country in 2015. The top complaint was about discharge or eviction, meaning that this is in the nursing home setting, that the nursing home issued a discharge notice and were discharging the resident for whatever reason from that facility. And the second complaint was about failure to respond to requests for assistance. That usually means that residents have pulled their call light and the facility is not responding in a timely fashion. And then the third complaint is about dignity and respect and staff attitude. So simply meaning that residents are complaining that staff are not treating them with respect or dignity, which is obviously one of their rights, to be treated with respect and dignity. You can see the other complaints here, so I'm not going to go into every single one of them, but I do want to mention that the top 3 complaints, transfer, discharge, failure to respond to requests for assistance, and dignity and respect, those have been the exact same complaints for the last at least 6 years. The top 10 board and care or assisted living complaints are in 2015 are as listed. The top complaint was about medications, administration, and organization. The second, food service. It's not cold, maybe it's the quality they're not getting enough, or the quality that it doesn't taste good, or maybe it's still cold or not hot enough, or too hot. And then the third complaint was also about discharges, so similar to nursing homes. And then as you can see, dignity and respect is right after that at number 4. An important difference, just so you know, and you may already know this, but nursing homes, there are federal requirements for nursing homes participating in Medicare and Medicaid, meaning receiving funding from Medicare and Medicaid for taking care of residents, but there are not any federal requirements specific to assisted living. So that's all based on state requirements, and those vary significantly across the country. So if you don't already know your Ombudsman program in your area, please get to know them. Contact the Ombudsman program if you know of a resident that would benefit from a visit from an Ombudsman program representative. Contact the program if you or someone you know needs information about long-term care services and supports. Ombudsman programs can provide general information about long-term care facilities because they visit them often. A lot of facilities, a lot of Ombudsman programs try to visit nursing facilities and assisted living facilities quarterly or annually, and are often, they have to respond to complaints that come in, and so they visit in response to complaints as well. So they have a really solid understanding of these facilities that they visit. An Ombudsman program, due to conflict of interest, they can't say, I prefer facility A over facility B. They can't provide their opinion like that, but what they could do is explain to a potential resident or the resident's family member things to look for when they go and visit a nursing home or assisted living. Some signs of good care, some signs of poor care, some questions that they should ask the facility staff when they're looking for a facility. They could also identify if their state publishes any type of survey data of those facilities, then they can share that information with the consumer or direct them to the federal resources that provide that information. So they can, even though they can't share their preference over one facility or another, they can provide a wealth of information about specific long-term care facilities, what to look for when you're visiting them, as well as just some considerations of the long-term care system in general and services that are available either in their state or their region. Please share information about the Ombudsman program with residents that you may know, or any of your family members or any of your colleagues, and visit our website for information to share with residents. So even though the Ombudsman Resource Center, we primarily serve Ombudsman programs and help them do their job, part of that is sharing information for them to share with residents and consumers. So there's a lot of consumer information about resident rights, quality care, about the Ombudsman program, and so on, that's available either on our website or the Consumer Voice website. So I'm going to go through that too. In working with the Ombudsman program, as I mentioned earlier, Ombudsman programs are responsible for systems advocacy in addition to individual advocacy. So oftentimes, Ombudsman programs will collaborate with other organizations for either systems advocacy or community education on topics of a shared interest. And so if they're looking at their complaint data and they notice some trends in complaints, then they may reach out to or connect with another entity that shares that concern, and then they can work together. So that's one way to work with the Ombudsman program. And then, of course, individual advocacy, just some pointers to remember. So if you ever were to file a complaint with the Ombudsman program and you're not the actual resident, it's just important for individuals to remember that when working with the Ombudsman program, Ombudsmen do have access to resident information with resident permission, but they can't share that information unless the resident gives permission. It's important to respect the resident's right to complain and their right to contact the Ombudsman program. And then again, Ombudsman programs can't share resident information, and some residents choose to remain anonymous during the complaint process. So it's really just up to the resident. How to contact the Ombudsman program. Facilities, nursing homes, because there are federal requirements, are required to post contact information for the program, and then some states actually required assisted living facilities to do the same. And you can also find out contact information not just for the state Ombudsman program, but even local Ombudsman entities, as well as other state long-term care services and supports by visiting this map on our website. And just as a reminder, our slides, in addition to the recording, all the slides will also be available after today's webinar. So we'll make sure to email those out to everyone that attended and to Bill and Rebecca so they can share them more broadly with your network. So again, how NORC supports Ombudsman programs: we provide training, we have resources, we have a technical assistance frequently asked question page that's new, and we create this quarterly newsletter. It's called the Ombudsman Outlook, and all the archived versions are available on our website as well. We do provide information, but we do not provide advocacy. So we inform Ombudsman programs on issues that they advocate about and advocate for residents, but we, as the Resource Center, we're not an advocacy organization. We are funded by a federal grant. On our website, this is just a shot of our homepage. It's divided up into different tabs, as you can see at the top, and we have more than 20 issue pages. So if you want information about abuse, the use of antipsychotic medications, dementia care, emergency preparedness, just go to that issue button at the top, click on that, and you can find an entire issue page about it. We also provide a lot of information about program management, including volunteer management, program promotion, systems advocacy, and so on. If you go to our website and you have a hard time finding something, because there is a lot of information there, there's the link on this slide to the site map, so you can see everything that's available. So as I mentioned, I do want to talk a little bit about the National Consumer Voice for Quality Long-Term Care. They're a national advocacy organization for individuals receiving long-term care services and supports, no matter where, meaning they could be nursing home residents or living in assisted living, or they could even be receiving long-term care services in their own home. So the Consumer Voice is an advocacy organization. They receive the grant from the Administration on Aging to operate the Resource Center. So as an advocacy organization specifically for consumers, they produce a ton of information for long-term care consumers. So that's why I wanted to highlight the consumer voice today, because there may be some resources on here of interest to you to share with individuals. There's a separate page, as you can see these buttons right here, specialized information for long-term care consumers. That includes nursing home, individuals living in nursing homes, assisted living, and individuals receiving care in their home. And there's information specifically for family members and citizen advocates. There's also a separate page for policy and advocacy. These are just screenshots of very few, two of our resources. This one I thought you may be interested in because it talks about piecing together quality long-term care. It's a consumer guide for options for long-term care services and advocacy tips. So it's not specific to a nursing home setting or assisted living. It's more of an overview of long-term care services in general, and it provides some really solid advocacy tips for looking for care, quality care. So I thought y'all may be interested in that one. And then we, of course, have a ton of fact sheets, and that nursing home resident rights fact sheet is just one of them. There's an entire page for resources for long-term care consumers, and as you can see, it's divided up below in bullets based on setting. So you can just click there for more information, and resources for family members, and then resources for advocates. We are in the month of October, and October is Resident Rights Month. And so there's a lot going on right now at Consumer Voice and across the country with ombudsman programs as well as facilities participating in Resident Rights Month. This year's theme is It's All About Me, My Life, My Care, My Choices. And Consumer Voice produced fact sheets about Resident Rights Month, promotional materials, so that logo that's on the slide, letters to the editor, a press release. These are all materials that ombudsman programs or others could use to promote Resident Rights Month and get involved. Consumer Voice is also selling materials and products like buttons for Resident Rights Month and posters. And this Resident Rights Month activities calendar provides some ideas for facilities to promote resident rights during the month of October. A big part of our Resident Rights Month celebration every year is what's called the Residents' Voice Challenge. And we invite residents across the country to send in entries about their rights. Why are resident rights important to them? What does it mean to them? And we used this year's theme this year to ask them some questions and ask them to respond to them. We have received videos, poems, artwork, stories, all kinds of different entries. So I wanted to point out that link to those entries if you wanted to check those out. They're really, really meaningful and provides great insight to the life of long-term care consumers. The Consumer Voice has a new product called the Resident Advocate Newsletter. This goes out, it's a free quarterly newsletter for residents of long-term care facilities. It's going to provide information on resident rights and care issues, news and updates on national policy, as well as some self-advocacy tips for obtaining person-centered quality care. So this is a new resource specifically for residents, and again, it's free. So if you know of residents that are interested in joining the mailing list, you can just send Consumer Voice an email. Or if ombudsman programs or other individuals want to download the PDF version and share it, you're more than welcome to do that as well, and those links are provided. Okay, so I just ran through those slides, so I know I provided you with a lot of information, but I wanted to make sure that you had plenty of links so you can search out some additional information about not just ombudsman programs, but also the Resource Center and Consumer Voice. And I'm happy to answer any questions that you have right now. So I'm going to look in the chat bar, the questions, and see if we have any questions to respond to. And feel free to raise your hand as well, and I can unmute your line if you'd rather ask a question instead of type it. Okay, so I do see one question, and it's a great one. How do you find out which states allow ombudsmen to deal with long-term care in people's homes? That's an excellent question. Thank you. We, as the Resource Center, have maintained very close contact with state ombudsmen. In fact, we provide orientation training for new state ombudsmen. And so that's how we find out, the Resource Center, if they've expanded services to home and community-based services consumers. If a consumer wanted that information, then they could either contact us and we could provide them with that information, or they could visit the site, the map that I shared earlier, and find contact information for their state program and contact them as well. So I hope that answers your question. If not, then please let me know, but that's an excellent question. What's the success rate in resolving complaints? Also a good one. I want to say it hovers around 60 to 70% resolution, but that also varies per state. But on average, I think that's about right across the country. So excellent question. And again, it's based on the complainant. So usually it's the resident that we're basing resolution on. But if the resident cannot communicate for themselves, then it would be the other complainant, whoever brought that complaint forward. Yes, thank you. Just another question, in the role as a peer or caregiver mentor, can I include this information to the caregiver for future reference? Yes, please, please do. That would be fantastic. And include this information, and don't hesitate to let them know that they can contact us too, the Consumer Voice staff or NORC Center, for any questions about long-term care as well, and we can connect them with their state-specific resources. So thank you. Please do that. Would a long-term care ombudsman assist residents with placement in a different care facility? That's also a good question. Yes and no. So what I mean by that is that if an ombudsman receives a complaint that a resident wants to relocate to a different facility, then yes, they would talk to the resident, see if that's really what they want to do, and support the resident's right to choice. So then they would help with that resident and advocate to make sure that the current facility that they're in is doing what they need to do to facilitate a safe discharge or transfer, and that that resident has enough information about the receiving facility or wherever they want to go. Sometimes that can be challenging because there may be cases where the resident wants to relocate, but maybe their family member doesn't want them to. But bottom line, if the resident has capacity and can provide consent, and it's truly their wish to relocate, then the ombudsman would be advocating for that resident's wishes. So, but they wouldn't actually be the person doing the transfer or connecting the two facilities. Again, the ombudsman program would be communicating the resident's wishes with the facility to make sure the facility did what they needed to do to support the resident's rights, if that makes sense. Another question about the 200,000 complaints investigated. How many facilities did that cover? I can't answer that question immediately, but that's a good one. But I think the number was over 27,000 facilities were visited quarterly, but I'm not sure how the complaints, how those fell among the specific facilities. We do have numbers from the NORC system about how many of those complaints were in nursing homes versus assisted living. And then we also do know from NORS if some of those complaints were outside of the facility setting. So if those were in the states that actually work with home care consumers, or if it was in a different setting. So, but I don't have that for you right now, I'm sorry. But if you're interested in that, I could see if we can dig that information out of the data, or maybe ask the administration ACL that collects all the data if they have it broken down like that. Yes, so another question about promoting, would it be helpful to promote the Ombudsman program to put it in the Paralysis Resource Center guide? Yes, that's a great idea. And I would I'd love that and would be happy to talk about that more. I did receive a copy of that guide and was extremely impressed with all the information in there. So we'd be happy to be part of that. So thank you for that question. Another good question, how long does it take to see action after contacting the Ombudsman? Well, it says me contacting you, so I don't know if you mean NORC, the Resource Center, or the Ombudsman program, so I'm going to answer for both. The Resource Center, we try to respond within 2 business days to requests for technical assistance or any other questions. Ombudsman programs, oftentimes they have state policies and procedures in place, and it varies across the country. So if the complaint is about abuse or neglect or maybe a transfer discharge or some immediate pressing issue, then that complaint would take priority of another one, so they would respond quicker to that. But so it really depends on the state, their state policies and their resources. Not all states have as many staff or resources or volunteers as other states, so the response time varies. But I do know that they try to get out there as quickly as possible and that they do have to prioritize the type of complaint. So just one second, Bill, I just saw your message, and yes, I'll unmute you. Just one moment. Okay, Bill, go ahead. You're unmuted.
Thanks, Amity. I had a question. So we find in our community now these days people are transitioning, or instead of in the hospital, sometimes instead of going home, they're being transitioned into long-term care or short-term care, those kind of facilities like we're talking about. Any ideas or any suggestions on how a family, let's say, can prepare for that, for their loved one to be transitioned over to a facility like that?
Sure. So just to make sure I heard it correctly, so to help family members and others prepare for if someone's leaving a hospital and transitioning to a long-term care facility?
Exactly, yeah.
Yeah, and that is really, really tough. And Consumer Voice, since they are an advocacy organization for consumers, they do have some materials about transitioning and getting ready for advocating for quality care in that setting. So really the only tips that I have immediately would be, if possible, because sometimes I know that transitions occur quicker, or discharges from hospitals occur quicker or last minute, more last minute than folks prefer. But if possible, I would find out as much about that receiving facility as possible and go visit that before your loved one is transferred out of the hospital to that facility. That way you can at least speak with the staff, get a feel for it, ask any questions that you have before that transition, understand resident rights in that facility, because again, they do vary. Nursing facilities, skilled nursing facilities, as I mentioned, they do have federal regulations, which includes a lot of federal rights and protections for residents. But if it's not a nursing home that they're transitioning into, that it's important to know whatever state regulations or protections individuals have living in those facilities. So I would just do as much research as I could before that transition occurs, and then share as much information about your loved one as possible with the receiving facility. Visit frequently, be as involved in their care as your loved one will let you be or wants you to be engaged in their care, because it all, everyone has different relationships and different desires. But I would just say visit as frequently as possible and be as engaged as possible. And if your loved one can't communicate for themselves, whether it's they can't communicate and that's just a short-term issue or long-term, then make sure that you share your loved one's history with the facility and their preferences, and make sure that their history and preferences are considered in their care that they receive. So that's not really a short answer, but at least some immediate tips that come to mind. Yeah,
well, there's never a short answer with that. So, but did you say that Consumer Voice maybe has some materials there, so we might want to grab some of that and have that part of our PRC information?
We do. What they did, though, it may be a little different. It wasn't the transition from a hospital setting to a long-term care facility. They were looking at the consumer experience of transitioning from a nursing home into the community. because as you probably know, yeah, there's a lot more opportunity for that because there's more funding now available to transition and provide Medicaid funded services in the community. So they were speaking with consumers that had transitioned out to see how that experience was, and gave them some tips to other consumers on how to improve that. So I think that could probably be still applicable. So
yeah, we run into that as well. So that's perfect on both fronts. So thank you.
Excellent. I'll make sure to get that to you then, Bill.
Yeah, thanks.
All right. Well, I think I addressed all the questions in the chat box. If there's anything else, please put it in the chat box or raise your hand. Okay, I'm not seeing anything come in. Yes. Did I hear someone? No. Okay. Wow, y'all asked some excellent questions. Thank you so much. And I've already learned a lot just from your questions about maybe brainstorming some other ways that we can share information and resources with you all, both from NORC and Consumer Voice. So thank you so much for joining this afternoon's call and for asking the excellent questions and for doing what you do as part of the peer network. So really appreciate it.
Well, Amity, I want to thank you as well. Like I said, it's been great getting to know you and understanding the program. We'll probably reach back out to you. Well, we're gonna be talking about, you know, between this week and next week anyway, but maybe some ideas on what we can send out to other people who weren't able to attend, just to give them a little insight into this itself, but also maybe additional materials they want that we can forward on to them to kind of make them more aware too. So we'll be chatting about that, but really very, very informative and very helpful. And those were great, insightful questions. So thank you, everybody.
Perfect. Thank you so much. Have a great day, everyone. Thanks.
Thanks, Amity. Take care.
You too. Bye.